Hi, welcome back to the profile. My name is Christine Yosenga, and today we are with Dr. Prosper, and he's going to be telling us about sickle cells. As you know, next month is the month where the world holds a whole worldwide sickle cells awareness campaign, and don't forget that this show is brought to you by Alicia Fashions and Makeup Glam. And you can find them on their contacts on 0700-389-800, and they will be able to cater to all your beauty needs. You're most welcome to the profile, Doctor.
Thank you very much for this opportunity. Dr. Katugume Prosper is my name, from Messenger District. I'm glad to be hosted for this session and about this sensitive topic of sickle cell diseases. It's my honor to be hosted. Thank you.
Okay. So people we have what we call sickle cell trait and sickle cell disease. What is sickle cell trait?
Thank you for the question. The sickle cell trait, that means that to go back to very small building blocks of the body, or what builds the body. We go to genetics, the genes. Yeah, those are the smallest building, what makes us. So when it comes to a trait, it means that within your building blocks, within your genes, you have that one part of sickle cell disease. You have it within your blood, within your genes, but you don't show the symptoms of people who are having sickle cell. You have the gene or that building block within you, but you don't show the symptoms. That's what they call the trait.
Okay. And then what about the disease?
So about the sickle cell disease, so for the trait, you have one block that makes the disease. For the sickle cell disease, you have the two blocks or the two genes that are responsible for the sickle cell disease. That means the features of the sickle cell disease can be shown. Someone can see and say you have sickle cell disease, both within the genes and outside the physical body that we see, the physical appearance. Okay. Yes, so for the trait, you have it within your blood, but you don't show the symptoms and the features. For the disease, you have it both within your blood and you can show the symptoms. People can see the features and say, yes, it's a sickle cell disease.
Okay, so that means you can live with a trait when you don't know that you have it?
Yes, you can live with the trait. Those are the people that we term as carriers. Yes, you have the trait for sickle cell disease, but you can only know that when you screen.
And what is screening?
So screening, it is checking. We check your blood to see if you have those genes or those building blocks that cause sickle cell disease. There are tests that we do within your blood, and we can be able to identify that you have sickle cell disease, or you have the sickle cell trait, or you don't have the trait or the disease.
And then what about the sickler? People usually talk about being a sickler. What does that mean?
For the sicklers, yes, currently we've realized that it is part of stigmatization. So people tend to refer them as warriors.
Okay.
Yes, warriors. Yes, but the term sicklers is still being used, but one way or the other it is seen as to be stigmatizing to the people who have sickle cell disease. So for what they call sicklers or the warriors, those are the ones that have the sickle cell gene both within their blood and even they show the features of sickle cell disease.
Okay. So is there a chance that someone can be a carrier, but when in their family blood there isn't anyone with it?
I will need, you can repeat the question.
Okay, like someone maybe has that trait, but there is, when you trace their background, there is no any other person who has it. Can it be possible that you be the first to have it in the family?
Genetically, that is not possible. Okay. Yes, because it is inherited. Yes, the trait and the disease is inherited from our parents. So rarely, within my knowledge, do I know that you can get it or be the first to get that.
Can you be able to look at someone and you tell that they have sickle cell? You know, like with HIV, some people predict, like when someone is slim, someone has this, they have HIV. With sickle cells, is there a case like that?
Most of the people with the sickle cell disease, it is not that you can easily see them and tell like all the other time. However, as the healthcare workers, you can look at the features. They are those that are specific to sickle cell disease. Yes, they are those that are specific that you can look at and be, you say probably this one, if we screen, we may find they are having sickle cell disease. Yes, depending on the features, some they can tell you the features and you can be able to predict. Others, you can just look at them and you can be, as a health worker, yes, you can.
What are some of those symptoms that those people show?
The features for people who are having sickle cell disease, I should say sickle cell affects almost each and every other body part, from the brain even to the toes. Yes, and in childhood, mostly it starts to manifest with the, they call it the inflammation of the digits, like the fingers, yes, around the wrist, you find the fingers become swollen. Yes, they become swollen. That is dactylitis. And I think even within the ankles, the small joints mostly, yes, they normally get inflamed, and actually the swelling is also painful. Yes, the swelling is also painful. Then you can also receive pain within the chest. Yes, that is also part of the features of sickle cell disease. And mostly they also have yellowing of the skin, like yellowing of the skin. It is pallor. We call it that is jaundice. Yes, there is jaundice and pallor because their blood volume is always low. Yes, their blood volume is always low. You can also have headaches. Then you can also have, we said, joint pains. You can also have bone pains. Others can also present with headaches because it also affects the brain. So you can also have the headaches or even the features of strokes. Then there is also limited growth. Mostly there is retarded growth. Yes, there is retarded growth. So there are so many. Yes, so many features.
So how is it transmitted from one person to another?
Sickle cell disease is not contagious, and when you use transmit, it is not appropriate with the sickle cell disease because it cannot. When you say transmitted, that means it can spread from one person to another. But like I said from the beginning, sickle cell disease is inherited. You get it from your parents. Okay. Yes, you get it from your parents, or it comes along your ancestral or hereditary line. Yes. So that means if I have sickle cell, you as a person who comes into contact with me, you will never get sickle cell. Yes, you cannot get sickle cell in any way when you come into contact with me if I had sickle cell. Yes, yeah. So it is what we term as non-communicable. It cannot spread from me to the next person. Instead, you inherit it. Yes.
So that means you can get it from even a very distant relative. Let me say like my grandma, my step. Can you even get it from a step?
No. You inherit it from your biological parents. So how it comes about is much within the genetics. Yes, one of your parents has to be having the trait. Let's say the father has to be having the trait and the mother has to be having the trait. If your parents are both carriers, then that means there is a chance of giving birth to a child with sickle cell. Or if one of the parents has sickle cell, is a warrior, yes, is a warrior, or what others call a sickler, and the other parent is a carrier. Yes, so the situations where the children are having sickle cell are in this. One of the parents has to be a warrior.
Chimba Charles. Here I talk about my sister called, I won't say the name particularly, I wanted to say it but I won't. Here I talk about her. She's suffering, she's dealing with sickle cells. She's facing a condition which many of us didn't face when we are given birth to, because it just came just like that. We didn't know that it will happen to her. We didn't know that someday we'll have a sister with a sickle cells, because among our bonds we have never got such a person before, not even in our particular family. But the chance got us bad, and our last born got such an effect of sickle cells. For starters, we didn't know how to deal with it, because we just used to hear about sickle cells. We didn't know how to deal with a person who is suffering, who is dealing with sickle cells, who whatsoever. But as time went on, we caught up with the situation, and we started dealing with her, though it wasn't easy, because in the first instances, my sister used to lose blood just like that. We didn't know what was happening. We took her to the hospital. We used to take her to pharmacies. She used to get sick, like severe sicknesses. We didn't know that it was sickle cells in the first instance. But when we learned on it, then there we had to visit the main hospital of my district, Uyuko district, where I come from. And that's when they told us that, you know, this person is supposed to be dealt with in this and this manner. And yes, up to now, she's in a good condition. She's in a good condition because of the care we take about her. But it's not easy to deal with a person with sickle cells. She looks healthy. She looks healthy. If she comes here, you cannot realize that she's even suffering from sickle cells, because she's being taken care of by family. We are always all over. We make sure that at least she lives in the environment where, you know, those people are complicated. The doctors told us that when she laughs a lot, she'll get sick. When she cries a lot, she'll get sick. When she gets angry, like, they are very complicated. So she's supposed to be in that condition where like everyone is caring about her. You're not supposed to annoy her. You're not supposed to do this and that. And that's what we are doing. we make her feel at home every time.
So does she suffer from the other diseases as a result of having sickle cells?
Yeah, I think now, like since sickle cells are already, sickle cells always weaken someone's body. Someone is the blood cells, the cells that fight against other diseases. So surely suffers from cough, like even but cough mainly. Yeah, that flu. It's not easy. That's why she suffers from every time.
Okay, so what kind of, are you getting any assistance from maybe the sickle cells organizations or anything?
Yes, we are getting assistance from a sickle cell organization. There at our village is called Rehabilitation Center for Children in Yoko District with sickle cells. The hospital is mainly for sicklers, and they are helping us. They are helping us because my mom applied for it, though she applied late, but we are able to get a sponsor because you have to first apply. They have almost like 1,000 children they are sponsoring. So when she applied, God gave us a chance that we got a chance to be among those who are supposed to be sponsored, and my sister now is on the sponsorship.
So like other children, is it like the children who know that she has that disease, do they isolate her? Does she ever have issues with other children?
Yeah, since she is young, there is none of her young ones that knows that she has sickle cells, I guess. But I don't know when she grows up whether she'll be isolated or whatsoever. But when we look at our report, the report card, there is always that thing which they call socializing, yeah, on their report card. She's social. She's always with other kids playing. She doesn't just get sick just like other sicklers because of the care given to her. Because we make sure that at least we try each and everything to make her be healthy. She doesn't know. She doesn't know. She's very young to know, and I guess if she gets to know about it, how will she feel when she's old? Because I saw some movie and a person was bitter with the parents for not having checked for blood, and just went on like that with the relationship and given birth to a person like him. So I don't know how will it be in future if she gets to know the causes of sickle cell, because that's a major cause. If you don't go for blood test with your partner, that's the major cause. But when love calls, I don't know whether there's anything that can stop it. My sister would be far better than she is now, but just because of sickle cell, she's sometimes limited to do some things. She's a hard-working girl. Sometimes she wants to go to the garden with us, but she cannot go. Sometimes, every time she wakes up early, like she's a determined one, but there are things which is limited to be doing because of her sickness, and that gives me pity. It makes me not feel good.